Thank you. The gentleman yields back. The chair recognizes Mr. Balderson for 5 minutes for questions.
Thank you, Mr. Chairman, and thank you all for being here today. My first question is for Dr. Walk. Thank you. And forgive me, I see you down at the very end, but my name's tags are a little blocked there. But as we look at recent events, such as COVID-19 pandemic and monkeypox outbreak and the recent bird flu spread, we must take biosecurity and pandemic preparedness to top national security priority. Many experts have expressed concerns that future pandemics could be increasingly severe. As co-chair of the Pandemic Preparedness Caucus, I am committed to ensuring that we are ready for the future health threats. The CDC was created to be the nation's lead on infectious disease outbreaks. Dr. Walk, does your office hold regular staff-wide emergency operating drills, training, or exercises to prepare for future outbreaks or public health emergencies?
Yes, we do. Thank you for the question. Not only with moving forward with after the COVID epidemic, we noticed a number of issues that we needed to improve. And through the Moving Forward initiative, we made some changes actually, not only in the way we would respond with our workforce, but also the way internally we would, push our guidance out faster and communicate faster as well. So we continue as we improve to continue to try to exercise those SOPs.
Okay, thank you. Are our states and localities included in these trainings?
Yes, absolutely.
All right, perfect. Thank you very much. My next question is for Dr. Layden. Dr. Layden, thank you for being here. On February 3rd, 2023, a train derailed in East Palestine, Ohio. As an Ohioan and a representative for counties in the nearby areas, I do not represent the affected area. This incident is incredibly concerning to me, as it should be for all of us. The CDC arrived in East Palestine 3 weeks after the train derailment. There is no denying that the derailment spread toxic chemicals into the air, soil, and local waterways. While I understand the CDC has been assessing chemical exposures and health impacts after the derailment, I am concerned that not enough attention has been placed on this issue. I would like to know what else is being done to ensure that the health, safety, and potential long-term effects of the derailment are monitored. And we are also, it seems like every day or every week we're hearing something else coming out about this derailment. So thank you if you could answer that.
Yeah. So as someone who's worked at the state and local of public health, I share your concerns. These events have a significant impact on our communities. I am not familiar with that investigation. I'm happy to defer some colleagues if they may, or we can get back to you with additional information.
Would anybody else like to talk about that, or we can have that information submitted? Go ahead, Dr. Walker.
Our lead agency, the head of our National Center for Environmental Health, will be best positioned to answer that question, but we'll get back to you.
Thank you all very much. My next question is for Dr. Juergen. It's no secret that the serious public distrust in the CDC. We also know that individuals in your position are often aware of illnesses that may lead to pandemics or outbreaks much sooner than the general public. This is something that comes with the job, but also requires adequate handling of such sensitive information. During the COVID-19 pandemic, there was a lack of transparency and honest communication with the public. I understand that communications with the public have been acknowledged through the Moving Forward initiative. However, I'm not convinced that this is enough. What are some lessons that we've learned about the importance of transparency and honest communications with the public during the COVID-19 pandemic, and that your center will prioritize?
Thanks very much. In our center, it's the National Center for Emerging Zoonotic Infectious Diseases, but I've been at CDC for almost 30 years doing mostly infectious disease epidemiology and outbreak control. And COVID was a humbling event for all of us. I think, coming out of that, we've really changed how we're doing business. And in addressing the public's trust, we're focused on, like you mentioned already, transparency, where people need to see both how and why we develop evidence-based public health recommendations. That we also learned that we need to be listening. We need to better understand where people are and how we can meet them where they are with public health recommendations. You mentioned also that clear communication. We absolutely have to communicate the uncertainty that's happening at that situation and work with the public to get the most understandable recommendations for protecting Americans from infectious threats. And then finally, I think a big lesson learned was that we have to work together, that we can't do this alone, that the community needs to have better participation in the process, and we need to work with clinicians, stakeholders, and others to fight infectious diseases together, because we can't do this alone.
Okay, thank you very much, Mr. Chairman. I yield back.
Thank you. The gentleman yields back, and the chair recognizes